take a moment to introduce our speaker. So Dr. Johanna is a licensed clinical psychologist, assistant professor, and associate director of the Juvenile Justice Behavioral Health Lab at the University of California, San Francisco, at the Zuckerberg San Francisco General Hospital and Trauma Center. So she's in the sunnier part of the city, as we were just saying. Dr. Vogt's research and clinical work focus on addressing the behavioral health needs of youth and families impacted by the legal system. She uses community-engaged and longitudinal research methods to understand the effects of adverse childhood experiences, structural racism, and legal system contact on adolescent trajectories, as well as leveraging technology to develop and test novel interventions. I'm really interested. I've read a little bit about the work that you're doing, so I'm really excited to hear what you are going to share with us today. I'll turn it over to you.
All right. Thank you so much for having me. And thank you everyone for joining during what is lunchtime for those of us on the West Coast, though I know earlier in the day for others. So, today I'm really going to be talking a lot about doing telehealth with teens and with the transition age youth or young adults. And I want to be focusing mostly on ways to maximize or ensure safety and privacy, creative ways to build trust and engagement, and different ways that you can use technology to kind of monitor progress and reinforce progress in treatment. So a little bit about me. So I don't have any financial disclosures to report, as Kara mentioned. I do receive funding from the National Institutes of Health for my research. So I am a white woman. I have light brown hair. I'm wearing glasses and a white shirt with little kind of polka dots on it. This is a picture of my dogs for those of you who can see it, just because I think it gives a little bit of a happy boost for us sitting through talks all day on Zoom. So I am a white Jewish queer woman. I am a clinical psychologist. I work mostly with adolescents and their families. I do work at an academic medical center, and I operate at the intersection of the legal and behavioral health systems. And I share these pieces about myself just because I think it's helpful context for what I bring into doing the work that I do and the telehealth work. So, as many of you know, I'm sure at this point, especially in the summit, that telehealth is a really broad term, and it encompasses the delivery and facilitation of health and health-related services, which can include medical care, provider and patient education, health information services, and self-care via technologies and digital communication tools. So this can include live video conferencing, mobile health apps, store and forward electronic transmissions, remote patient monitoring. But for this presentation, when I use the term telehealth, I'm really going to be focusing on remote service delivery that includes both audio and video components in a two-way interactive communication. And that's using the Center for Medicare and Medicaid Services definition. So for those of you who've been working in the field in the last few years, I'm sure many of you have experienced that we had to really rapidly transition most of our clinics to telehealth service delivery in March 2020. And so I'm sure that everyone's experience across the country and across the world was really different with this. But at that point, there was less guidance out there on how to deliver telehealth services safely and effectively, and less evidence existing about the effectiveness in general, particularly with youth. And so I just present some of this data here to show we had a group of 8 academic medical centers who were providing outpatient care to youth and families in the mental health space. So both kind of psychology, social work services, psychiatric services. And there's just some data in this paper that's kind of interesting, showing the rapid transition to telehealth over those first 2 weeks and documenting some of the key kind of facilitators and barriers to that transition, things that had to change within all of our systems, like billing regulations, how we credential providers, and whether that's different for telehealth services, how we actually had even access to platforms like Zoom on a wide basis. And we have a new paper that's under review that had 13 academic medical centers. And this really shows on this chart here, kind of the proportion of telehealth compared to in-person visits. And the darker that the color is on the chart, it means that it's a higher proportion of telehealth visits compared to in-person. And what this really is saying is that we never, within this over a year period of a follow-up, returned to in-person levels of care at the same amount that we were doing prior to the COVID-19 pandemic. So I would argue that telehealth is sticking around. There is some kind of talk of insurance companies no longer reimbursing for telehealth services. So we'll see how that impacts our ability to deliver care. I'm hoping that that does not happen, at least for most insurance companies, but we'll have to see. But at this point, many programs are still really actively using telehealth. But much of what we know about telehealth services is still from prior to the COVID-19 pandemic, when this really expanded and became much more mainstream. So we have some evidence, for example, that youth who are living in rural and lower income areas generally didn't have sufficient access to Wi-Fi needed to access telehealth. Again, prior to the pandemic, when there was a lot of efforts to expand Wi-Fi access, as youth were at home doing schooling and having to kind of rely on the internet to stay connected during shelters in place. We also know less about ethno-racial differences in telehealth utilization, but there has been concerns expressed about exacerbating racial inequities in access to care by over-reliance on technology. And there is some data published that suggests this may be an issue. There was one academic medical center that found that within the first 30 days of the transition to telehealth in the COVID-19 pandemic, non-white clients had lower visit completion rates than white clients. Also before the pandemic, there was some evidence published that showed Black patients were less satisfied with telepsychiatry services and less likely to use these services than their white peers. And they were more likely to express concerns about the physical absence of their clinician. And it's unclear whether these inequities and differences persisted over time. So there's more work that's needed in this area. But I use this really to just kind of set the stage as we talk about delivering telehealth services. And I think really important to consider is whether telehealth services are actually as effective as in-person care for youth. And so I'm going to just do a really quick overview of some of the literature on this. So at this point, there's a growing body of evidence that shows that telehealth services delivered through video conferencing actually produces equivalent outcomes to in-person care for youth. And so studies have examined targets like child behavior problems, obsessive compulsive disorder, anxiety, and depression. And this is consistent with research with adults that shows this equivalency between video conferencing and in-person services. But there are still relatively few studies that actually examine this equivalency with youth. So there were 2 recent meta-analyses published, one that only had 5 youth-focused studies for ages 3 to 17 included in their sample, and that focused more on individual types of telehealth versus in-person services. There was also a meta-analysis that looked at family and group therapy, and that had about 20 studies. But both of these did show that telehealth was just as good as in person. So there's a little bit, again, less known about kind of patient preferences around telehealth versus in person. There's some evidence that, youth living in rural areas tend to prefer in-person services over telehealth, but see telehealth as kind of an important adjunct for their treatment. And we often think about telehealth as being particularly important in rural areas where there's longer distances for folks to travel and maybe less providers. So I think it's important, though, to still consider what youth actually want or prefer. And, within the adult space, there is some evidence that shows that working alliance is not as strong over video conferencing telehealth as it is with in-person, but outcomes are still just as good. And to my knowledge, this has not been explored with youth. But again, it's important to consider. And we'll talk a little bit later about kind of creative ways to use technology to maximize engagement. But providers tend to experience working alliance as worse than patients are reporting. So I think it's important to remember that with our perspective as well. So now, we've talked a lot about how telehealth is really widely being used right now. There is evidence around the effectiveness. And I think a really important piece to think through is, though, is it safe to do telehealth with youth? And what do we need to consider when we think about the safety of telehealth services? And the answer is often yes, but there are some important pieces to consider. I want to review this tool with you. It's called the Privacy and Safety Protocol tool for telemental health, because I think it's really helpful for distilling some key safety considerations when you're providing telemental health services with young people. And the tool was developed actually in collaboration with some folks at University of Washington who's been hosting the summit. But it's based on authors' experience and also published telemental health standards of care. And they conceptualize safety across 3 domains. So environmental safety, clinical safety, and then safety-driven disposition planning. So on the slide here is a QR code that you can scan if you want to get to a copy of the article, which has the tool in it. And there's just an image on the side that shows you kind of the start of one of the modules about how you would screen for safety before starting telehealth services. So the tool, I think, is useful in that it draws on 2 really practical models. One is actually just taking a checklist approach, and checklists can be really helpful in terms of kind of making sure that providers are following key steps in both routine and unexpected circumstances, which helps to ensure safety. The other is this kind of timeout approach, which is used in medical procedures like in surgery, where the whole provider team has to come together and pause before starting a procedure and run through some specific items to make sure that you can minimize error and everyone knows their responsibilities. And so there's a variation used in this tool called the telemental health timeout, which I'll get to in just a bit. So there are really kind of 6 key areas that are talked about with environmental safety, and I won't read through every single one, though they are all on the slides, and you can see more in the paper and in the tool itself. But what I think is nice about this is that it talks about kind of pre-session activities, things to do during a session, and then things to do at the end of a session or before you wrap up. And so within environmental safety, kind of these first ones here are like the location of the young person, contact information, and participants. So prior to the session, these activities can be done either by a clinician or by an administrative staff member in a clinic if you have those kind of resources available, which I know not all of us do. But as you know, at this point from delivering telehealth, hopefully it's really important to know where the young person is located. And when we're working with youth, it's also really important to know where a caregiver or a trusted adult is at the time of a session and how to get a hold of them. Part of why that's important is even for teenagers, you know, their caregiver or parent might not be participating actively in the session. But if there's something like a safety concern and you need to get a hold of someone, you don't want to be kind of caught scrambling, not knowing how to do that. A lot of the end of session activities have to do with kind of making sure you've documented updated information so that you have that for your next session. But again, contact information, it's really useful, for example, to have a phone number that's not being used for session to be able to reach someone. So if you get disconnected, you don't necessarily know if it's like the technology has malfunctioned in some way, right? The internet dropped, the phone died, the computer died, or if there's a safety issue. And, you know, I'm not sure if anyone else has had this experience, but I've been on a meeting before where someone was driving in the meeting and they got into a car accident, right? And so I strongly advocate for you not allowing teens and young adults to be driving or in a moving vehicle while a session is happening. But you do need to think through kind of safety concerns that could come up and how you manage them. And when would you deploy emergency services, things like that? What's the agreement that you have with the young person? Kind of these other elements to environmental safety, having additional contacts. So this could be about local emergency services or other support persons. Depending on where your clinics practice, you may be kind of providing services across a state in an area where you're less familiar. And it's important that you know about emergency services there, again, prior to a session starting, and then also make sure that the youth and the family know about how to access those as well. Privacy can be really complicated. I think, you know, we all have different amounts of space, let's say, in our home, and not all youth will have a private room to participate in sessions in. I work with mostly publicly insured and uninsured youth, many of whom have no kind of private bedroom. They share all space with other family members. And so sometimes you have to have session in the bathroom because that's the only place where you can have private closed door space. And you need to think through, like, has everyone in the house been able to use the bathroom before your session starts? Or maybe they do need to sit in the car as long as it's not in motion. But again, if they're sitting in the car, you want to know what the car is in case a safety issue comes up. Is it at their home address? Are they in a parking lot of a shopping center? Are they at school? Where are they? Privacy also can be challenging because with a computer screen or a phone, we don't actually have a full view of the room or the space that a youth is in. And so you can get creative with privacy strategies, like how will you know if mom has walked into the room? Well, you can come up with a code word or a code phrase or something like that that's been used. But it's really important to talk about privacy expectations before sessions so youth can prepare as much as they can, and then confirm that they're in a private space, document any strategies that you've come up with. Lethal means is also really important to assess for. So it's really important to kind of know ahead of time for a session when we're thinking about if telehealth is safe, if there are lethal means in the home, especially if there are any risk concerns for a teen or a young adult. And with caregivers, you can work with them to make sure that they've secured or removed any lethal means, reviewing emergency protocols, getting any relevant releases of information that you might need if a safety concern would arise. Clinics often now have protocols around lethal means restriction. There are also some useful interactive tools online that can help guide families in how to take these steps. But it can take a lot of education, and depending on what's in the home and everyone's beliefs about, let's say, having guns and guns that are locked up separately from ammunition, things like that, just important to talk through and to come up with safety plans around, particularly if there are any risk issues. The same that you would do if you were delivering in-person care, but we have a little bit less control when clients join sessions from their home, and we're not able to kind of limit what's in the space. So there's also clinical safety, right? And so you have to consider clinical appropriateness for telehealth services. As I showed, there is evidence that telehealth can be useful for a wide range of kind of presenting concerns for young people. But you should make sure that you're kind of using both telehealth screening questions to make sure they have even just access to technology to join through telehealth, because that can be a reason why someone might not be able to use telehealth services. Some clinics are lucky enough to have funds where they can loan out devices to young people, but that's not always the case. And you have to also be okay with knowing that you may not get them back at the end, which can be a little bit complicated. But clinically, screening for risk is really important to make sure that you don't need to be seeing them in person if there's a higher risk issue that's going on, using empirically validated scales, and then always coming up with safety plans. You can also do a lot around symptom management resources and providing virtual tools that can help with supporting young people in between sessions. There are lots of mental health focused kind of apps and online platforms at this point that can be used to engage youth. And teens do tend to like technology. They're on their phones and computers a lot. And so we don't necessarily want to encourage that so much more, but we can kind of make the most of what they're using. It's also just, again, really important to know who the key supports are for a young person and make sure that if there are safety concerns that you've looped in caregivers and any other trusted adult. With young adults, sometimes caregivers are not actively involved in their lives. And so you may need to bring in a roommate or a partner or a close friend, someone who has the maturity and kind of emotional ability to provide support to the young person, not putting them in a caregiver role though, but figuring out who those key natural supports are. And then once you've kind of gathered all of that environmental and clinical safety information, figuring out, is telehealth actually appropriate, or do you need to move to in-person services if that's an option? During the pandemic at different points, I think certain clinics didn't have the option for in-person services. Now many are, as we're opening back up, or many places have opened back up, I would say, in past tense, and are very actively in person. But if you are doing telehealth services ongoing, just continuing to assess kind of clinical appropriateness as it goes. And so clinical acuity can really change over time. As an example, I had a young woman that I was working with who, before she turned 18, which was like early in the pandemic, mom had been actively involved. She was engaged in treatment, was presenting with PTSD, and we were doing trauma-focused care. All of a sudden, started using kind of more actively substances than she had been, and then ended up having her first psychotic episode, right? And so in the middle of a telehealth session is starting to engage in self-injurious behavior that's never been present in session before. So thinking about safety in that moment, having to involve a caregiver to prevent self-harm that's happening, having to get crisis supports involved. So you have to kind of think through how safety can change over time. And then with a new clinical picture, is telehealth still appropriate, or do they need to be seen in person? So a lot to consider there. So the telehealth timeout is part of this tool as well. And this is kind of the key pieces that you want to think through in terms of privacy and safety at every single session. So you do this every visit. And the idea is that you're pausing, making sure you've covered all of these points before you proceed with services. So these are really knowing the location of the youth and a caregiver or trusted adult, making sure that you've actually verified if it's the first time that you're meeting with them, that it is who you're supposed to be meeting with, and also having contact information for that available caregiver or trusted adult, backup phone number and contingency plan for losing connection, making sure you've got confirmed privacy and you have those strategies if privacy is compromised that you're using, lack of lethal means or secure status as clinically indicated, and then having a contingency plan for in-session safety issues as needed. So this might seem pretty redundant and hopefully feels like standard practice to many of you, but I think it's really helpful to just have this kind of quick checklist that you can run through, make sure you've covered all your bases before you dive in. I also will say I saw folks filled out some of those polls that I launched, so thank you for doing that. I saw that about 2/3 of people said they felt fairly moderately or very comfortable with delivering telehealth services. About 1/3 were less comfortable or not at all comfortable. And some of the key things that people noted that they were worried about had to do with safety concerns and then also kind of what to do in a crisis and engagement. So we'll get into some of the engagement pieces there, but relying on tools like this and structure can really help to kind of bolster confidence around privacy and safety. So building trust and rapport. I talked about earlier how as clinicians, we often feel like rapport is worse over telehealth than in person. And so I think it's really important with young people to get creative, and people shared on the poll some of the strategies that they like to use. And I saw a lot of things about like art-based activities, using things online for mindfulness. Those are all really awesome. And I'll hopefully share some more with you that you may not have used yet. But so, common challenges with telehealth can be issues with technology, right? If the internet all of a sudden stops working, if your audio isn't working, if a device battery dies, if someone's working on a tiny screen, right? Like you can have lots of challenges that come up. People often feel too as if they're limited in what activities they can do over telehealth, right? So people sometimes working with young people, you might do things like play a therapeutic board game, and that's really hard to do over Zoom. And again, we can feel a lack of social connectedness with the young person. And also that's something that everyone, I think, experienced during the pandemic was a loss of social connectedness, and that can feel even harder over Zoom. So there are a couple of really useful guidelines that have come out. One is about building rapport with youth. It focuses much more on like teens and younger. And then one is about transition age youth and young adults. So these are, again, 2 QR codes that you can scan if you want to get to these guidelines. But they really kind of lay out four key things to consider with telehealth. So first is setting the scene. And this can make a really big difference. So in the same way as you're thoughtful about setting up your professional space so that it's welcoming to whoever it is that you're serving, and this may be kind of based on developmental appropriateness too. But it's important to have a professional setup in your virtual space. And this can be tough if you're working at home, depending on how much space and privacy you have. And so virtual backgrounds can be really helpful with that. Using Zoom, you can also use fun virtual filters, which can help with engagement. There's like silly ones where you can have a little piece of pizza that's on your head as a hat, or you can kind of just play around with different filters, and kids can think that that's fun, and teens can get into it too. We're having different virtual backgrounds that can promote engagement. I like to hide myself view. And so I usually will kind of at first look at myself on video, make sure there's nothing distracting in the background, and then hide the self view. So I'm only focused on the young person that I'm working with and not looking at myself as well. And I sometimes will encourage teens or young adults to do that too, just so that there's not that level of self-consciousness of staring at yourself while you're talking too. Headphones can be really helpful for both the clinician and the youth if they have access both for privacy and for sound quality. And I really would encourage the young person to be on camera. I know in the beginning of the pandemic, a lot of teens were like totally fine being on camera. Then schools, by us at least, started allowing teens to not have their cameras on during school. And so they got really used to just being on Zoom and these virtual platforms without having to show their face. But it's really challenging to read nonverbal cues if you can't see someone on screen. You don't know if they're actually in a private space or if others are around. So you might have to get creative to get them to come on camera and to even incentivize that at times. But it does make a really big difference. So I think the other piece is also just introducing telehealth. At this point, most young people know kind of how telehealth works and may have at least met with like a medical provider, if not a mental health provider. But you can always ask. And if they have not used telehealth before, explaining how it works, answering any questions, and then just kind of setting up any of those safety considerations that we talked about before. In terms of building rapport, it's really about still just being warm and focused on the young person the same way that you do in person, and really trying to not focus on the technology, which is hard when there are technology issues that come up. Teens and young adults are often much more tech savvy than many of us are, which is great. And also, you don't want to be kind of bumbling around with technology. So I'd encourage you, if you're going to try out any new strategies or features on whatever platform you use, to test it out before sessions so that it works as smoothly as possible. That said, things always kind of can go wrong. And so I think using humor when appropriate is really helpful, and also just being patient with yourself and trying to model that with the young person as well. So we'll talk about maintaining engagement in a minute, but I think you can use kind of some creative tools. So I'm going to talk a lot about Zoom, just because that's the platform that I'm most familiar with and what UCSF, so where I work, uses. But you can do these on other platforms too, because many of them have similar features at this point. So I like to use more creative check-ins with images. You can do things like this rose, thorn, bud check-in, where roses are about successes of the week, thorns are challenges, buds are things that you feel hopeful or potential about. You can share different like emojis or weather images, and youth can use like annotate features or stamps, things like that, to select how they're feeling in terms of their mood. But it gives a little bit of creativity into how youth are describing their feelings, and just a little bit more visual engagement as well. In a group setting with young people, if you have more kind of socially anxious teens, they can also use the chat function, which can help kind of boost engagement, even when they're feeling a little bit less comfortable. Icebreakers can also really help with building rapport, and they can encourage young people to join on video. So a couple that I like to use, one is like a scavenger hunt where they have to find something specific in whatever their environment is and then show it to you on screen. That can kind of turn this into a game, and also requires then camera to go on. In a group setting, you can also do something called Sketch Your Neighbor, which can be a little bit of like just a fun mindfulness participation activity where everyone tries to draw the person next to them on the screen, and then the group has to guess who they drew. The one thing I'll say, I'm talking a lot about being on video, is that sometimes young people don't want you to see their space. And there's a lot of different reasons for that. And I would encourage you to be respectful about it, and particularly in a group setting, not requiring them to be on video. I think the other thing, though, is you can work with them to set up virtual backgrounds or filters or things like that that can help them to feel more comfortable. So you can get creative, but I think exploring one-to-one with the youth around their perspectives or a reason for not wanting that is important too. Polls can be really helpful, especially in a group setting, with allowing for more anonymous choices, but you can also use them individually to like check the pulse of an activity, of how it affected mood. I've even used this for things like assessing for suicidal ideation, if it's easier for a young person to just respond to a single question on a poll versus having to verbalize it if it's something I'm asking about regularly. And you should always create your polls before the meeting so that you actually have access to them. That's an important thing to note. Whiteboard can be really useful for doing kind of more creative activities as well. Like you can draw things that bring them joy, or you can kind of do some brainstorming on there as well. Breakout rooms are great in smaller group setting or in group settings because it allows for smaller group discussions or providers to work with multiple youth at the same time, or paired up activities, things like that. And then you can do a lot of creative activities online. So you can share a mandala and you can kind of color it together as a mindfulness activity. You can watch sea otters at the Monterey Bay Aquarium on video. You can take a virtual tour of the world. There's even now, there's a chain analysis tool that I really like called the WTF Happened game. This is initially a card game, but they have a virtual version as well, where you can actually create kind of a chain of like thoughts, feelings, and behaviors of what happened in a really engaging way for youth. So you can kind of explore lots of different things. We also often will bring in like kind of pop culture type videos and use that for exercises, like watching a clip of a TV show that a teen likes and trying to do an emotion identification activity with it. So you can kind of bring things that are of interest to them. You can also use like memes or kind of images, just things that are relevant for the teen to provide some positive reinforcement and make the treatment fun. So I do really feel strongly that therapy, is hard, but also should have elements of fun to it to keep youth engaged. So in terms of engagement, I think a huge piece of this is actually first making sure that you have set goals collaboratively, so that you are working on things that are important to the young person. This can help establish rapport and make sure what the youth wants to focus on or thinks is important is the focus, and this can instill hope for change. It's really important to actually track progress. Often this can kind of fall off, but thinking about you as the clinician monitoring progress, also getting the youth involved in monitoring their own progress and the caregiver, however you can, and providing kind of positive reinforcement around that. So teens like reinforcers, just like young kids do. It doesn't have to be kind of a sticker chart in order to promote engagement. It can be positive reinforcement verbally. It can be having time to look at a YouTube video that they like in session, or showing funny memes or things like that. So regularly monitoring progress and doing this at any chance you get and providing structure around that. Really lots of praise, celebrations, reward. I think, with goal setting in general, you can use a lot of creative strategies. If we're talking about, let's say, SMART goals, right? So specific, measurable, attainable, relevant, and timely goals. There are tons of worksheets out there. You can simply just screen share and fill out a worksheet together, but you can also use tools like mind mapping. You can do this either on the whiteboard, or there are other online platforms, or even through Google. Now there's things like Jamboards that you can use to more interactively engage the youth around this. You can also track progress through technology and apps, which can be fun. There are some apps like they kind of gamify tracking, like Habitica is one, where you kind of have to set goals and you get progress. There are others like Habit Share and Tally and Streaks, but using visual tools can be helpful for young people and provide just some reinforcement around that as well, and encourage self-accountability. Text messages and kind of app reminders can also be useful for encouraging youth to practice skills. If you're lucky enough where you can automate text reminders and have a system for that, then that can be really useful. But you can also get youth to set their own reminders to practice skills on their phones or using a reminder app. There are lots of different mental health apps that have free content to complete things like mood check-ins or mindfulness practice or journaling. I'd encourage you, if you're going to have the youth try out something like setting a reminder, to do it in session, because otherwise it may not happen and they won't remember that they had to set the reminder. So setting up for success in that way. And leveraging social networks, right? So if you're not physically there in person, and in general for young people, right, we're only there for such a small fraction of time with them of the amount of time in their life. And so really leveraging family, friends, other service providers, accountability partners, whoever is important for the young person. So in summary, telemental health services can be as effective as in-person care, safe to deliver, and engaging both during and in between sessions, and just encouraging you to use your creativity around that. Here are some relevant readings, and I'm happy to, in the last few minutes, answer any questions. So thank you all so much for listening and for your time. I'm going to stop the share here.
Great. Thanks so much, Johanna. That was really quite interesting. Lots of ideas for engaging your clients over telehealth, as you said, in person or in session and outside of session and in between. That's really fantastic. We have just a couple questions that a few people have said, yeah, ask this question.
Okay.
So one of them is, I provide telehealth and in person. I have found many who did not want to move back into the office. Are there studies being done that show the benefits of telehealth versus in-person appointments?
That's a great question. So I would say that's really where it's much more limited around the data. And a lot of it is prior to the pandemic. So we don't yet, because we're just moving back to in-person, I think really know what it's going to look like in terms of the mix of in-person and telehealth services now in this kind of later in COVID, or I say post-COVID in quotes, because it's not really over world. I have a lot of young people too who do not want to now come back into the hospital. Depending on where you work too, that the setting may not actually be that inviting for young people. Like I work in a public hospital, and our clinics are set up really nicely, but to get there, they have to go through a lot of chaos sometimes to get to the clinic and navigate public transportation and a lot of barriers. So I think there's a lot of value to continuing telehealth where you can, as long as it's clinically indicated and kind of safe to do so. Given the evidence that's out there so far about telehealth being as effective as in person for outcomes, I don't imagine that would be so much different now with allowing that to continue, but more data is needed.
Yeah, interesting. In another body of work that I'm doing, I did hear people saying, we can't assume that our digital native teens are always going to want to do telehealth because they had so much of it, Zoom stuff in school, that they want to come in person now. So that very interesting.
Yeah. And I think there are some who really do and love to be in person. And that's where too, I think getting like the preference of the young person, if you have that flexibility in your clinic and either one seems appropriate, is really great to do.
Yeah.
Or a mix.
Yeah. Yeah. And I'll hold my question. I'll put some more questions up for you. So you mentioned incentivizing the teen for getting on the screen. What are the recommendations around that?
Yeah, I think it really depends on what your program's resources are and what the family's resources are. So one of the clinics that I work for, it's a grant funded program, and we have a lot of flexibility in how we do incentives. And so part of the group agreements was that if teens showed up to session and came on camera for a certain portion of a group session, for example, they could earn a small gift card at the end if they did that for a certain number of sessions. And it was like a $5 gift card. It wasn't big, but it was enough where it had some level of kind of motivating factor for them. I think too, if caregivers have resources to do that, you can do it sort of like you would a sticker chart with younger kids, where if they're coming on, they get like a point or, money in the bank around that to work towards some type of incentive or reward that's important for them. I usually would try to start with like creative strategies to engage them and working with them to see why they don't want to come on screen before going straight to a reward like that. But incentives can be quite powerful for many of us.
Yes. True enough. With new updates to Zoom, clients now use avatars to attend sessions. Can you speak to the positive and negatives to this feature?
I think it's a mixed bag. I think that avatars can be really fun for young people. And I think then you're not actually seeing them, which makes it harder to, again, read nonverbals, read emotional expression, feel like you're connecting with an actual person, and it could disguise identity, right? Like you can't tell the difference if someone's showing up as a potato, if it's like this teen or if it's their brother or someone else, right? So I think there's limits to that. I think you can use it in a playful way to kind of boost engagement and have some fun, but I can't imagine a situation where I would do, let's say, a full session using an avatar in that way, unless there was some real engagement challenge. And let's say that was a reward where they got to do that because they thought that that was really fun. And I would try to work with them in a collaborative way around it. I will say too, that earlier in the pandemic, there was a lot of use of these Snapchat kind of avatar filters that you could connect with Zoom. And I would say, like, privacy wise, you have to just also think about like what data is stored if you use an external app like that. Like if a young person's using Snapchat filters, it does actually collect and track certain data, which is not necessarily HIPAA compliant, things like that. So I would just always be careful about what platforms are getting integrated and used.
Right. Boy, it's a whole new world, isn't it?
Yeah.
Any input on working with youth and families that may have multi-systemic involvement, such as probation, child welfare, school systems, and the use of telehealth with higher acuity cases?
Yeah, so I would say telehealth can still be really effective with these cases. I think a lot of times the systems don't necessarily agree with that and feel like you have to be in person to really meet the need of the young person. And I think that is true in some scenarios, but if you can get them on telehealth, they're still able to engage. I would say I sometimes have a little bit more of like privacy concerns with like level of system monitoring of a young person where they maybe don't trust as much being on telehealth. I think sometimes there's just there's a lot going on in their lives, and you do have to really meet them where they're at, which can mean going out physically in person. And not every family member may have the kind of willingness or ability to get on Zoom or whatever telehealth platform it is. So I would say it can be really effective. We have some studies using telehealth with youth and families impacted by the child welfare system who are separated and living far apart, where actually they don't have access to family-based services otherwise. And telehealth is really effective in that kind of a scenario. But I would say it's really family dependent.
Yeah. Okay, great. This one, I don't know if you can do this. Could you post or go back to the card game you had mentioned for us to get it?
Yeah. So there's this game called the WTF Happened game. It's based on DBT kind of framework and chain analysis. And if you just kind of Google WTF Happened DBT game, you will find the website, and it can show you kind of either the virtual version and how you download it or how you can purchase it. And I use it both virtually or in person with teens, and it can be really like just a fun, more engaging way to do chain analysis. That group and related ones also have a lot of really cool videos that you can show, like of how to do DBT skills, things like that are more kind of animated, which can be really engaging for young people too.
Great. Thank you so much, Dr. Folk. That was a really fascinating presentation. Lots of things to think about. So thank you. And thank you folks for joining us, and we'll see you in a few minutes.
Thank you.